Hi, my name is Lord Cabahug, and I'm going to be properly showing you how to initiate an HDC and to set up an IV tubing and regulate the flow rate. So the first thing you need to do is to look at the physician's orders and to reference it to any of the client's record to make previous records to make sure that the physician is not prescribing anything that the client may be allergic to. Next, you need to perform hand hygiene and to provide privacy. Next, you need to introduce yourself, such as my name is Lord Cabahug, I'm going to be a practical nursing student today. Next, you need to identify the client with two identifiers, such as their name and birth date. And for this scenario, I'm going to be using case scenario number 8, which features Mr. Slushy, a 63-year-old male who has been admitted to subacute as he has collapsed at home, and he has in his record it shows that he has poor skin turgor and a dark urine output. So one of the prior assessments I would do is to do a skin assessment, especially to see the turgor if it still is poor, and to see the condition of the skin if it's dry, and see the elasticity of the skin rather, and to look at the mucosa of the patient if it's dry or it shows any symptoms of like dryness. Next thing I'm going to do is to take the client's vitals, such as temperature, pulse, respiration rate, SpO2, blood pressure, and the pain assessment if Mr. Slushy is feeling any kind of pain or discomfort. And next thing I'm going to do is after washing my hands, I'm going to inform Mr. Slushy that I'm going to be initiating an HDC tube on him, which I'm going to do at the upper right arm, which I've deemed to be clean from my previous assessment, my initial skin assessment rather, sorry. So now I'm going to demonstrate proper needle stick prevention injury by doing this rainbow, because it lessens the tension on my arms, on my fingers rather. So it would just prevent. It's just a safer way overall. So assuming that this pillow is Mr. Slushy's right upper arm, I'm going to give it a slight pinch. I'm going to insert it in a 45-degree angle. Once it's there, I'm now going to secure it with some tape. 1, 2, 3. So this is how the HDC port would look like on a client. And at this point, I would focus on one of the client's orders. For the purposes of this video, I'm going to focus on normal saline, which is to be administered at 50 milliliters per hour for the purposes of this video, and even though he has other drugs, such as potassium. So I'm going to do the first of my 3 checks, such as if it's the right patient, right drug, right dose, right route, and right time. And I'm going to check if there are any abnormalities to this saline bag. For the purposes of this video, this is a used saline bag. I've used it for practice. And I'm going to check the expiration date over here. I'm going to assess it if there's any leaks, if it's cloudy yeah, I'm just gonna check if there are any abnormalities to the bag. Next, I'm going to do my second round of checks, as I'm preparing it. So for the purposes of this video, I already have another saline bag over here, and I'm going to check if it's the right name, patient, drug, dose, time. Next, as I'm putting everything away, as I'm cleaning up, throwing any wrappers that need to be thrown, I'm going to check again if it's the right patient, right drug, right right dose, right route, and right time. So it says here that the saline has to be administered at 50 milliliters per hour. So that would be the total volume times by the drop factor of 10, which is here indicated by the IV tubing, and divided by 60, which is 60 minutes which is 60 minutes, yeah. So that would be 50 times 10, 500, divided by 60, that would be 8.3, and we round that off to 8 drops a minute. And we would divide that by 2, which is 4 drops per 30 seconds, and divide that by 2 again, which is 2 drops for 15 seconds. Of course, I need this to be I need these calculations to be checked by another nurse, just to follow just to make sure that it's the right calculations, rather. Sorry. So at this point, I'm going to make sure that my IV tubing, it's all closed, such as this, and the roller is all the way down there, just to make sure that it's all closed. Next, I'm going to spike this by doing so. Be careful as not to contaminate the end part, rather not to touch like the white, the white part, the end part. And I pinched it as to prime it. Yeah, I just pinched this part to prime it to let some of the liquid flow down. And I'm carefully looking at this part to make sure to measure the drop rate, rather. So at this point, I would I would hang this first. And I'm going to attach the necessary attachments. Which is this end part. For the purpose of this video, this is a used part. There should be like a plug or anything. I'm careful not to contaminate it. I'll just pull this back. I'm going to insert this. Oh, sorry. Not contaminating it. Just to insert those together. I'm screwing it in. So that would be the necessary additional plug-in for this type of needle. And after I primed it, I'm going to release. I'm going to unclamp this, and I'm going to slowly roll this up to measure 2 drops per 15 seconds. For ideally, for the purposes of this video, I don't have a watch, so I'm just going to use a timer in my computer. But yeah, you would need to have a watch to accurately tell the time. So I'm just going to roll it up slowly to release some fluid to make sure it's 2 drops. 2 drops per minute 1. Yeah, that's correct. I'm going to hang this up on a stand. I'm just using the lamp for this video. I'm going to attach this to the client's arm. After I remove this cap, for the purposes of this video, I have very slippery hands, which I use the shirt for. Yeah, I have very sweaty hands, which is the reason why that was so hard for me. Now I'm going to attach this and just see that it is being administered. I'm going to cut this off. Yeah, and before administering, before connecting this, you would have to do the rest of your 5 checks. Tell the patient if it's you would have to do the rest of your 5 checks at the bedside to make sure you did tell them the right reason. If they refuse the medication, educate the patient. So I would tell the patient for this type of medication that this is to help them rehydrate, because they are showing symptoms of dehydration rather, and I would do the right documentation. You would have to document this on your you'd have to document this. Yeah, you have to document this on the right kinds of documentation and the right evaluation. Check to see if the patient is doing well after. Then record everything, especially the inputs and outputs of the client, and leave the call bell in reach, and adjust the height or the bed position. Yeah, so you would have to adjust the bed position to a comfortable working height. I should have done that. I should have stated that. I should have verbalized that at the beginning of this video, but it slipped my mind. And the side railings are adjusted to make sure that the risk of fall is minimized. So that would be how you initiate an HDC, set up an IV tubing, and regulate the flow rate